Hey, what's up everyone? It's your favorite nurse yogi, Lesline. I wanted to talk about the different types of nurses that you could be. If you don't know already, I am a registered nurse, and I recently had somebody ask me, like, what is the difference? Like, you hear nurse, and then some people, if you're in the nursing field, you're like, I'm a registered nurse, or you're like, I'm a nurse practitioner. So let's get into what the difference is. And even if you're like, I ain't going to nursing school, you probably know a nurse, have seen a nurse, some kind of capacity. So I'm here to just educate you about what the difference is so you can have, just be more aware. So the first one here, this is a CNA. So you see that the first one says Certified Nursing Assistant. This is also known as, it says it in the name, an assistant. Nurse tech is what they call them in the hospital, and the education is rather quick. You see there, it could be a 4 to 12 week program. You do have to take a certification, and you get a state license, which is really cool. There is some like salary numbers there, but I don't quote those, all right, y'all? So that's CNA. You help the nurse with turning patients, feeding the patient, those kind of things. The second type of nurse that you can be is a licensed practical nurse, okay? So let me also, I just said the first type of nurse, because CNA is not a nurse. You are not a nurse if you are a certified nursing assistant. So we're going into LPN, licensed practical nurse. It's a 1-year program of school. Again, this stuff can be slightly different based on the schooling that you may go to. You do have to take an NCLEX, get anxiety just hearing that word, and you earn a state license. So this is LPN. I also want to talk about LPN here. When I used to work in the hospital, I now work remotely, so I don't work in a hospital anymore. So correct me, nurses, if I am incorrect with this. But when I was in the hospital, they were pushing for LPNs to become RNs, for RNs to get their bachelor's, okay? So if you are looking to be a nurse, you probably won't even see LPN anymore, if I'm going to be frank with you, because a lot of jobs don't want that. All right, let's get into the one that I am. I am a registered nurse, okay? So registered nurse, you get your associate's degree in nursing, and it's about a 2 to 3 year program. You take the NCLEX, God. And then there's also, you can advance that degree, which I did about 2 years after I worked in the field. I decided to advance my degree and get my bachelor's in nursing. Because I was able to, I already had my associates as a nurse, it only took me maybe 2 years. It was maybe less than that. It was a really quick turnaround because I already had my associates as a nurse. So when you hear somebody say, I am a registered nurse, this is what they're talking about. It's a step. I don't like to say hierarchy in that. I don't want anybody to think I'm looking down on any of these. We need all of these, okay? We need CNA we need everybody, okay? But registered nurse, you also have more responsibility. So the more you go up the ladder, so we started talking about CNA, LPN, RN, you see what I'm saying? You have more responsibility. So as an RN, I can give medications that a doctor tells me to give. An LPN can also give medications, but there's certain little things, which is test questions, where they'll be something with I think blood transfusions LPNs can't do. Correct me if I'm wrong, nurses. So it's little nuanced things, the difference between LPN and RN. All right, this is the one that we all know and love. I've talked to so many people lately who are like, oh my God, I love my nurse practitioner. She's amazing. They're amazing, right? So nurse practitioner, they're the big dogs, right? As a nurse practitioner, you have to have a master's. So again, you're advancing your degree. So typically, if you are a registered nurse, you may want to be you know what? I've been in the game for a bit. Let's advance this degree so I can start, possibly prescribing medications, because that's one of the main things when you become a nurse practitioner, you can prescribe medications. So it is a master's in nursing that you get. It's a 2 to 3 year postgraduate program. You must also complete, in-person clinicals, which is really interesting because they don't say that for RN. And RN, you do have to do in-person clinicals. You can also, if you didn't know this already, because this can kind of be confusing, you can get your doctorate in anything. Let me just preface that. You can get your doctorate in mathematics. You can get your doctorate in nursing. You can get your doctorate in education, hence Jill Biden, okay? So you can get your doctorate in nursing. Again, that's a 3 to 4 year postgraduate. It requires a capstone DNP project. So you have to have an idea, a project where you're going to advance nursing in one way or the other. And within becoming a nurse practitioner, what's really cool is there's different types of nurse practitioners. So I don't know if you know this, but you do have, like, maybe you see a nurse practitioner for your primary care. So there is there's primary care nurse practitioners, and then there's also mental health nurse practitioners. So it's called psychiatric mental health nurse practitioner. Okay, so there's mental health nurse practitioners, which can prescribe psychiatric medications. They can also provide therapy services, which is really cool. And then the physical health side, that is your family practice nurse practitioner. So you can see a nurse practitioner for at like a primary care doctor. Okay, so let me know if this clarified things, because if you have friends that are in the nursing field, they will tell you very quick what they have, because it's a lot of school. Like, it's a lot of school and it's a lot of work to get any of these. So if your friend's like, no, I'm a RN, BSN, la la la, like, say, okay, got it. All right, let me know if this was helpful. See you in the next one.